Hi, my name is Jen Jones. I am the pediatric physical therapist at Savannah Speech and Hearing Center, and I'm going to start us off with our Play with Purpose in the first year. Jumping into 0 to 3 months, you'll start to see a couple skills already start to develop. You'll start to see some tracking, so baby will start kind of following you, following a toy, following their siblings. They're getting their head more, their postures more in the middle and getting their head in the middle versus kind of slumping over to one side or the other. And then we're also seeing babies start to pull their hands into what we call midline or hand to hand or hand to mouth. So there's a couple things that you can do to really help promote development here. The biggest thing is prioritizing floor play. So floor play is going to allow them to get their own movements and not constrain them. We do know that kids that are placed on the floor more frequently actually kind of hit their gross motor skills a little bit sooner than kids that are not. So ways that you can start doing this are tummy time, but at this age it's going to be a little bit different. You can do a short but frequent tummy time. So a lot of times I say, if there's something that you're doing on a regular basis, like diaper changes, it's a great way to kind of build a routine and do a minute or so of tummy time after that. Side lying is another great choice. So you can see this in the picture above me and then also to the side. But really all you're doing is you're placing your child on their side and supporting them in the back just so that they feel secure. But this is great because it takes away some of the impacts of gravity. So it's going to let them move their arms and their legs around a little bit more. It'll make it easier for them to get to the hand to hands and hand to mouth. And then it's also just putting pressure on a different point of your skull. So really up until this point, a lot of our babies are on their back. They're sleeping on their back. So we want to take off as much pressure as we can off the back of their head. And tummy time and side lying are great ways to do that. I know that there can be a lot of questions about baby equipment at this age, but also as babies are getting a little bit older and are able to use different pieces of equipment. The baby industry really does target the need for equipment, but I just wanted to mention that to progress through your milestones, you really need very little equipment. And truthfully, floor time is going to be much more powerful and should be prioritized because the kiddos that are placed on the ground have actually been shown to progress through their milestones a little quicker than the kiddos that are not placed on the ground as frequently. Now, I think equipment can be great in moderation. I think it's really important to have a safe place to put your child, especially as you go to cook dinner and need to take a shower. But looking at each piece of equipment is going to be important. I think they're not all created equally. I think there are some pieces that I would look for. So I do look for like bouncers and swings that tend to have a little bit more of a firmer surface. The reason that we call these container pieces is because they do contain and restrict a little bit of movement. So I'm looking for a firmer surface if your baby is positioned in a reclined position, because that is going to allow them to move their head freely a little bit easier. And then I'm also looking at posture. So for things like a stander, I'm looking at if their feet are flat. And then for any seated devices, I'm looking to see if they're tilted over to the side or able to hold themselves up in the middle. And then I do have a couple favorite pieces. So I do really like the pack and play. I think that is very similar to the floor, but it's a great place to put your child down safely. And then I also like the play mats because I think they are great to encourage some movement. And good old tummy time. Tummy time has been a lot more emphasized recently because of our safe sleep recommendations. So now our infants it's recommended that they are sleeping on their back and that it's decreased the rate of SIDS or sudden infant death syndrome. So all that is good, but we just want to be more intentional about our wake times and placing our little ones on their belly. And that's important for a couple reasons. We want to make sure that we are continuing to strengthen the neck, arms, shoulders, and back and helping all those muscles get ready for those next milestones like crawling, pull to stand, walking. But then it's also letting their kids see the environment in a little bit of a different way. So instead of lying flat on their back and looking straight up, now they kind of have a different way to see the environment and see their family. It also stretches the muscles in the front of their body. And tummy time, as I mentioned, is really a precursor for those upcoming skills. The other thing is that we are now lying on our back more. So we're seeing a lot more flatness on one side of the head or on the back of the head. And so it's a great way to also prevent flat spots on the head. I mentioned on a previous slide how tummy time in the 0 to 3 time frame is going to look a little bit different. So here I just have a couple different ideas of ways to modify it when you're still pretty little. And really it's all going to be about elevation. So getting your baby up so that way the impacts of gravity aren't quite as much and it's a little bit easier to lift your head. So I have pictures on here of using some sort of like nursing pillow or boppy. Obviously these are going to be supervised when you do these techniques. But you can also you can roll up towels, bed sheets, anything to kind of get you elevated. Tummy time on chest is my favorite way to do this because you're going to get a little bit of caregiver bonding. You get that face to face. You can add in some song or talking and get a language component. So really this age, the tummy time on your chest is my favorite. But if you had a exercise ball or a yoga ball that you may have used throughout pregnancy, this is a great time to pull it out. I know my words are a little cut off from the video, but doing tummy time on an exercise ball is another great way because you can kind of adjust by rolling it forward and rolling it back. You can adjust how hard it is by changing the angle, but then you can also kind of roll side to side and kind of add some little bit of bouncing to make tummy time a little bit easier. All right, on to 3 to 6 months. So now you're starting to see a couple more skills start to develop here. So now you're going to start to see grabbing your feet with your hands. You can see more grabbing toys even on your back. And then tummy time is starting to become a little bit more advanced. So this is kind of the time frame where you're going to start seeing a little bit more movement in tummy time. So while they're on their belly, you'll start seeing reaching for some toys or something called pivoting. Pivoting is where you turn yourself in a full circle on your belly. And then you're also going to see starting to push up on your hands and getting those elbows a little bit straighter. So kind of like a tall tummy time. The other skills that you'll start to see around this time is you may start to see some rolling and then also some sitting. So there's some ways that you can also play at home to encourage these exercise or these skills. And so I like to call it fancy tummy time. So this is really just placing toys out of reach. And what this does, it's going to encourage your little one to start reaching, and then maybe even start, if you place it to the left and the right on tummy time, they'll start kind of like racing for it and spinning on their belly. For sitting, what we typically see first is what we call like propped or tripod sitting. So that's where you're going to see that your baby is leaning forward, but actually placing support on their hands. I have a picture of this in our next slide. But again, I love the play mats, and this is really where the hand-eye coordination is starting to develop. So you're going to see a lot more movement on that play mat here. And these are just a couple positions that you can try out. So the picture above me is actually my son when he first started sitting. So that you can see that's very stereotypical of how he's putting his weight on his hands. So that's our tripod sitting. You can modify this by actually taking your boppy or nursing pillow or rolling up a towel or blanket and putting it like almost like a rainbow in front of your child and having them put weight on their hands. And what that is doing is it's just elevating the surface to make it a little bit easier. Especially in those earlier days, you're going to see them kind of slump forward, which may be putting a little bit of pressure on their belly. So by using that little bit of elevation is a great way to make it a little easier for them. And then this picture over on the other side is of rolling. And what I always recommend is, especially as you're getting to this 3 to 6 month point, it's a great thing to start working on earlier. And all you have to do is from using like their hips, is you slowly kind of rotate them over. And I love to do this every time you're doing tummy time. So it's just a great way to kind of start the process of being familiar with how to roll. All right, already to 6 to 9 months. And so here what you can start to expect is now you're seeing your little ones start to lift their hands up and sitting hands free. And they're starting to do a lot more transitions from sitting onto their belly and then even being able to go from their back and get them up into a sitting position. And this is usually where you start to see a little bit of crawling as well. So that which is going to start as a little bit of like an army crawl. And then you see that you'll start to kind of pop up to that hands and knees position position, progressing to crawling. So at home, a couple things that you can try out is as they are becoming a more stable sitter, try placing toys out of reach. So you're getting them to kind of reach out of their base of support, reaching forward to the left, to the right. Another thing that I love to do this is making sure that you actually place them on their back as they learn to sit. We want our little ones to get from a back position to a sitting position. You can actually practice this with them as over in this picture on the side, and you can kind of help them roll over to their side and slowly bring them up to a sitting position. And then starting a hands and knees position is great for this age. So you can see my son in the picture above here using a push toy. So we have that push toy stabilized against the couch where he is just playing on his knees. All right, so we're still kind of doing tummy time as you get a little bit older. It just looks a little bit different. So this is really where it's our advanced tummy time skills. So this is one of my favorite pictures from a study showing progressions of tummy time. But this is for reaching on your belly. It's showing that kneeling position, but then it's also showing a supported hands and knees position over your leg just during play. 9 to 12 months is when it really starts to get fun. We get lots more standing and lots of movement. You'll start to see baby pulling up to stand. So going from maybe their hands and knees position and grabbing onto a chair, the couch, and pulling themselves up into a standing position. You're seeing longer standing time, typically supported with their hands, like playing at the couch. And then you're even starting to see first steps. So stepping can kind of start in a couple different ways, and usually cruising is what we start to see first, is where you're standing somewhere with your hands supported like a couch and you're seeing some side stepping from left and right, and we call that cruising. Things you can do at home to help with these skills are walking with a push toy. As you see in the picture, you can use just a push toy. You can take it indoor, outdoors. You can also play with a water table. It's a really great way for them to be engaged and motivated to stay in that standing position versus lowering down to their knees. And then also just placing toys strategically out of place. So if they're standing at the couch, don't grab a toy and give it to them. Kind of place it a couple inches away and see if you can get them to sidestep to grab the toy themselves. The other way is just playing with them in standing. So like drop a toy to the ground, have them squat down and grab that toy and stand up. You could even get them, like instead of placing all the toys down on the ground, start placing them on a couch or a chair to encourage them to start pulling to stand. And time to meet the extended team, or toys that I just really like to use a lot in the clinic or even with my own kids. The format is our first one that I mentioned in our slides, but this one is really great for that hand-eye coordination, encouraging movement, doing tummy time on. I also really like rings, rattles, O-balls, starting younger, but you can use these as they grow to place them out of reach, so that way the baby can try to get to them to play with them. Also really great for a fine motor component. Using mirrors or contrast can be really motivating, especially in those younger ages, is when you're trying to work on tracking or even just motivation while being on your tummy. The play table and the push toy are both toys that I love for growth. I think this is something that you can start really young and grows with them as they are going from tummy time to sitting to standing and walking. I also really do love the water table. I think this is a great tool to get motivation for standing and walking skills. And this is usually a fun one and can be really motivating for your child as well. Okay, we made it through 12 months. So I also just wanted to mention when is a good time to have a little extra help or a little extra boost with gross motor skills. One of the things that I am looking for is symmetry. Under 12 months, we want to see as much symmetry as possible. So using both sides of our bodies, looking both directions. And this can oftentimes just be seen by moving only your left hand when grabbing toys, or only pulling to stand with one side of your body, or only looking to one direction. But you also might notice this with any feeding, if your baby only feeds on one side or latches to one side when breastfeeding. So those are really good moments to kind of take a look at, but also gross motor skills. And a really good rule of thumb is if you're not yet sitting by 6 months, if you're not crawling by 10 months, or if you're not walking by 15 months, it's a good time to kind of check in and just see if you can get a little bit more direction of if therapy would be a good fit for you. The other thing that physical therapy can help with is torticollis and plagiocephaly. Torticollis is when you're seeing a tightness on one side of your baby's neck. So what this will look like is maybe you're always seeing your baby tilt to one side and look to another direction. So if they're always looking to that one side. Plagiocephaly is when you're starting to see flatness on one side of the head. And then you may also see what we call brachycephaly, and that's just flatness on both sides of your head. So the really neat thing with this is early PT. So under 2 months, if you're able to start a program with a physical therapist, these symptoms actually resolve sooner than if you were to just kind of monitor and watch. So that would be another reason that PT could be helpful. To wrap up my portion of this presentation, I wanted to give you 3 big takeaways. Playing with intention is a big one that I like to recommend. I think this is it sounds easier than it really can be, but setting aside a good 5 to 10 minute chunk of the day to try to do some tummy time or getting your baby to track certain ways or working on sitting really can go a long way. And just placing your baby on the floor. So floor time is much more powerful than it seems that it can be, but this just allows your baby to initiate movement and kind of just let natural development take its course. And then also trusting your instincts. So if you feel that something feels a little bit off, you know your baby the best, and just following up with your pediatrician or a pediatric physical therapist as needed. Thank you, everybody. That is all that I have for you today for my portion of the presentation. I did want to put my email down on here just that if any questions kind of pop up, I'd be happy to help. It is the jjones@speechandhearingsav.org. Thank you for your time, and I look forward to talking to any of you.